Hi, I'm Chastity Falls, and today I'm going to talk about the assessment of psychomotor skills. The objectives for today include defining psychomotor skills, explaining the importance of these skills within the medical education realm, describing Bloom's taxonomy of the psychomotor domain, and identifying methods for faculty members to assess their learners and students in their psychomotor skills. So let's start with psychomotor skills. What are they? These are movement tasks that include skill, action, muscle movement, or manual manipulation. They also include motor and dexterity skills as mentioned above, but also involve the cognitive domain. Together they are associated with carrying out physical exams, clinical and surgical procedures, the use of medical equipment, and administering medicine to patients. This is really important in medical education because it's crucial and helps provide both quality and safe care to patients. The acquisition of psychomotor competence in these skills is important as it helps provide the quality and safe care that we want for our patients. The lack of competence does compromise overall patient care and safety, which is why psychomotor skills are important to be assessed within the medical education programs. Moving on to Bloom's taxonomy, there are three domains. They include cognitive, affective, and the psychomotor domain. We're going to focus on the latter of the three, which is also referred to as the kinesthetic domain. That involves coordination, physical movement, and the use of motor skill areas. Now, when we think about Bloom's taxonomy, we think about creating learning objectives, but also these objectives are used to guide the assessment. So assessing the psychomotor domain is really by measuring speed, precision, procedures, techniques during the execution of such tasks. Now we're going to focus on the 7 main categories using the Simpson psychomotor domain. And this really kind of goes from the simplest behavior as category 1 to the most complex category, which is category number 7. So the first category is perception, which is really awareness of the student when they detect those nonverbal cues. And when we describe or write learning objectives, we use the word describes, detects, selects, differentiates, and identifies. The second category is set. And this one is when students are ready to act and they know and act upon a sequence. So the verbs used to describe this category include displays, shows, reacts, moves, or begins. The third category is a guided response, and this is an early stage in learning in which the student really just does imitation. They perform acts as a demonstration, and so the verbs for students in this category include copies, follows, and reproduces. Moving to the middle, or the fourth category of the psychomotor domain, this is more of the basic, it's the mechanism or basic proficiency. It's really the intermediate stage of learning, and when learning responses become more habitual and can be performed by students with more confidence and proficiency. Verbs used to describe this category include constructs, assembles, displays, manipulates, and fixes. The complex overt response, which is category 5, is a skillful performance of students of the motor acts that really more involve and are at the expert level. They actually use the same verbs as the mechanism or the fourth category. However, these verbs will have objectives that really indicate that students have a performance of these tasks that are more efficient, better, accurate, and just quicker all around. The sixth category is adaptation, and these students have really developed their skills. They begin to move into the modification of movement patterns. These movement patterns are really more to fit special requirements, and these verbs for this category include reorganizes, changes, adapts, or revises. The seventh and final category, which is the complex behavior, is origination, and where students are really creating these new movement patterns for particular situations. And verbs really describe this category, which are arranges, creates, makes, initiates. This Bloom psychomotor domain really kind of mimics what the the saying in medicine is the medical mentality of see one, do one, and teach one. And this domain with these 7 categories kind of mimic that. Moving on to assessment. Assessment is when we as faculty can provide evidence that our learning objectives are met by our students. It's really a tool to determine intended learning outcomes of the course have been achieved by the students, and it evaluates progress of students in knowledge, skills, behaviors, and attitudes. A really good assessment program is based upon the learning objectives, the instructional activities that are provided to the students, and an efficient assessment method that's in place. The main objective for assessment is student learning improvement. When you do this and focus on this main objective, this really leads to overall student motivation and self-evaluation. It helps with content and knowledge retention and the transfer of learning and knowledge from that short-term to the long-term memory. When we talk about assessment tools, we really look back at the objectives and the verbs that we use within Bloom's taxonomy for the specific domain. This really helps align our objectives with our assessment. It also aligns our assessment, our objectives, with the instruction that we provide to our students. They all complement each other very well. If we look at our objectives using the Bloom's taxonomy and we assess at that same level within in that domain, we can really say that our objectives were clearly met. So we want to assess the level objectives at the level in which they were taught. Looking at tools that we use to assess psychomotor skills in medical education, there are really a numerous amount of them. There's really too many to discuss in this brief course. There's also a gap of research and knowledge to support a lot of this, or to provide any evidence to support these tools that we're using. The one thing that we have learned is that it's really important to assess psychomotor skills in a face-to-face situation. It's important to remember also that when we're looking at evaluation and assessment of psychomotor skills, we want to evaluate at a specific level that includes the accuracy, the smoothness, and rapidity of that technique or procedure. We also, when we're evaluating psychomotor skills, even though it's not specifically stated, we also are including the cognitive domain. And this is the domain where knowledge is attained by students along with the psychomotor skill development. It's more focused on the intellectual side of learning. One thing that we have to make sure before we assess psychomotor skills of our students is that we provide them a hands-on learning opportunity to really get good at developing these skills before they're assessed. So we want this practice in real time with feedback before being assessed on these skills. Psychomotor skills can be effectively assessed by observation, both in person and through video, demonstrations by the students, having the students write out a description of the steps involved within a psychomotor skill, from the first step of the beginning to the end and completion of the skill. Also, we can have students align pictures of each step in the sequence of performing a psychomotor skill or technique. Finally, simulation. Simulation is where we can use high and low fidelity mannequins or standardized patients. Even now, the use of virtual reality really gives us an idea to prevent a realistic approach or scenario for the patients to be assessed on these particular skills or techniques. It's really important to remember that psychomotor skills should be performed by students with an instructor who's evaluating the skill with a set standard. This set standard is really important for assessment for validity and reliability purposes. So that's why most of the psychomotor skills within medical education is really evaluated using a rubric or a checklist. When we think about specific tools, we're going to briefly talk about 3 tools that are used to assess the psychomotor domain in medical education. The first is the Objective Structured Clinical Examinations, or OSCEs. And OSCEs are used more for competency assessment of skills, process skills, and clinical management. These are standardized examinations, which is why they're more accepted. When they're standardized, all students will perform the same task, and they'll be using standardized patients, high or low fidelity mannequins. And then the big thing is that students are being assessed by direct observation in one or multiple stations. And really we're focusing on repeating measurements for examiners to assess, including communication skills, skill performance, and efficiency, all within one examination. It's important to remember that the use of the standardized patients and really matching our content and skills to our learning outcomes within the course really improve the validity of using OSCEs. The next tool is simulation. It's interesting to know that simulation accounts for a quarter of the nursing education, and this is a big move or push into medical education such as PA programs in medical schools, more so specifically looking at virtual reality. We are using simulation because it really creates a realistic scenario. Due to the advancement of technology as well as the lack of ability to have in-person or standardized patients, we use simulation now to really kind of help combat the issues that we have with the COVID-19 pandemic. But simulation creates realistic scenarios to evaluate the students. It really evaluates all three domains in Bloom's taxonomy in one setting, including the cognitive, the affective, and the psychomotor domains. And it can really help evaluate not only skills, but human behavior that traditional methods cannot really do. Finally, we are looking at supervised clinical experiences. These are work-based assessments, and this is when students are out on their clinical rotations and taking care of patients or evaluating patients while being directly observed by their preceptor. And preceptors may even have them do demonstrations. However, using supervised clinical experiences tend to be difficult and more challenging than the use of OSCEs or simulation. And it's because they have a really uncontrolled environment. Patients are often more acutely ill, and they have more complex problems than the students should be assessed at this point in level. There's also concerns for patient safety, and that has to be in the forefront of one's mind when thinking about using these clinical experiences for assessment of psychomotor skills. It also requires a high level of observation from the preceptor, which is very workload heavy and time consuming. Finally, the equality and the inter-rater reliability is difficult to maintain when using clinical experiences to assess these skills because students do not always have the same preceptor. And so when you have a different assessor and the use of different patients for evaluating these skills, it can really diminish your reliability between the raters. With the advancement of technology, also the use of simulation and OSCEs, we don't really use clinical experiences to evaluate competency for psychomotor skills. It tends to be more of that OSCE and the simulation that we use for pure psychomotor competence and assessment of our students. In conclusion, we talked about psychomotor skills and what they include. We talked about why they're important to patient care and medical education. We also mentioned and discussed the best way to assess psychomotor skills, as well as the development and the importance of creating and developing assessment tools that will improve the evaluation of these psychomotor skills within medical education. Specifically thinking about physician assistant education, students are really taught physical exam and procedure skills. These psychomotor skills are used to provide high quality and safe patient care. And we as faculty really need to understand how to appropriately assess such skills. As technology is advancing and through the COVID-19 pandemic, the use of standardized patients and OSCEs are still being utilized, but virtual reality is more kind of the future that is gaining momentum across the spectrum of education, as well as it's becoming integral in assessing student learners within psychomotor skills. And this is the references I used for today's session. Thank you.